These ladies are members of what the Ethiopian government calls its Women's Development Army.
My name is Tasfanish Ayano.
My name is Ndawok Desi.
My name is Mebrat Asras.
My name is Lut Asma'ma.
My name is Nana Amata.
The women are volunteers trained by some of the government-paid 34,000 medical outreach workers spread across the country. Their mission, to ensure better maternal health care for millions of Ethiopian women. In a village nearby, a family wait for Nanu to arrive. She's a qualified midwife and is responsible for 35-year-old Harut, who is close to giving birth to her fourth child.
The greatest joy for me is when a mother gives birth. When we go to the house and talk to the mothers, they usually accept us with a smile. They ask us a lot of questions and we advise them.
Harut and her family are typical of millions of Ethiopians living in villages where access to basic health care wasn't available until recently. Harut gave birth to her 3 other children at home.
The last time I gave birth, the placenta was stuck. I was in a lot of pain. I hope the health centre will be nice for me. That's why I've decided to go.
Harut has been complaining of back pain. Her husband and Nanu help her to a car supplied by the local medical centre 10 kilometres away. The government says its maternal healthcare outreach programme to villages like this across Ethiopia is working. And certainly the figures seem to suggest that's the case. According to the World Bank and the World Health Organization, Ethiopia has managed to reduce the number of children dying under the age of 5 by around 70% compared to figures in 1990. This health centre serves an area with a population of around 57,000 people. The staff offer pregnant women traditional coffee and food that they would eat in the village. The women are given postnatal care too. The government says around 50% of mothers now give birth in centres like this. Ethiopia still relies on donors for almost half its health sector budget, but the government says it is determined to expand its outreach programme.
Even though we have achieved significantly in making sure that we have several health facilities in the entire rural part of the country, including the pastoral areas of the country, we still believe that there is a sense of equity that needs to be addressed, where some areas have better access than the other.
A challenge it's hoped will save the lives of millions of children under 5 and mothers like Harut. Stratford, Al Jazeera, Northern Gondar, Ethiopia.